started seeing doctors in 2005, and which went through from then until 2014. That's how long I was going to see doctors for. Before I went in to see Dr. Valente, they put me on a lot of codeine, a lot of it. And I couldn't even get up to walk without being in pain. And it was in the leg, so I always thought it was always a leg issue because it was just the leg. That was my main objective, was to maintain the business. Everything else fell aside. I never did anything. I would go home, eat, sit. That was my day. Wake up, go to work, home, eat, sit. That was it. And I couldn't do anything else. It was just debilitating. It really was. I never went through that in my life because I was always in the gym or I was always in good shape most of my life, and then all of a sudden, out of nowhere, you can't move. And it's really difficult. It works on your brain too. Definite problem. Little depression maybe, because you couldn't move anything. And I was so tired of the pain, I would just get up and the pain would just go from my foot to my head. Nothing's helping here. And they won't let me go see, the only doctor I haven't seen is a back doctor, which my primary care doctor said I should go see a back doctor, but the insurance company said no. So I talked them into it, and that's when I went to go see Dr. Valente.
Mr. Morgan he's the perfect patient. I mean, he follows his physician's instructions. And for many years, he was following his physician's instructions. You know, multiple different specialists. He was doing all the things that he should have been doing. He said he had seen probably 10 different specialists, had 12 MRIs, you know, did multiple injections, changed his activity and lifestyle, took the pain medicines and anti-inflammatories. Unfortunately, those things after a while, they don't serve any benefit to a certain point. You know, the pain medications and the anti-inflammatories are good, but they're typically good acutely for short periods of time. It comes to a certain point where if you can't get over the acute injury, your body can't heal itself over, you know, a series of several months and in therapy and medications and maybe injections. You know, it does come to the point where if your quality of life is that poor and your activities of daily living have really plummeted, you know, I think at that point you've exhausted all your conservative options. And it's at that point when your quality of life is that bad as Mr. Morgan's got to, you know, I think it is at that point that you do consider surgery, because living a life of you know, not being able to move, not being able to concentrate on work, becoming depressed, you know, developing a habit to pain medicines, you know, that's no quality of life that any of us should lead.
I would talk to him. It would be a non-surgical solution and go from there, which obviously did not happen. But the way he talked to me, I do remember, it wasn't monotone like some of the other doctors. You go in there and they treat you like you're a piece of skin. It was a normal human conversation, and it was a nice conversation. I just didn't like what I was hearing, but it was a nice conversation. And he told me very specific things which nobody else did. I was just happy I wasn't in pain, to be quite honest with you. And but you know, then it got better. You know, it just changed. It changes really fast for some reason after that surgery. I mean, within 48 hours, you can tell the difference. It was very quick. And when I went home, I think laying flat is not the best thing, being in bed all the time, which I tended to do for the first 5 days. And then I started getting up and walking to a chair and sitting down. And that's when I really started noticing a lot of changes. When I started moving a little bit, even a little bit, was helpful. My biggest change was about 2.5 months into it, where I could start feeling the inside of my right foot, because I really hadn't been able to feel that in a couple of years. And that's when I knew things were really starting to change, because that was a big change for me.
Mr. Morgan, I think he did exceptionally well. Within 10 days of the surgery, he started to work, go back to work, which is great. But he took it easy. You know, he didn't do too much. He followed the restrictions. Because one of the dangers of these surgeries is that people after the surgery, they start feeling better than they were before. And then they become too active. And then what happens is the bones don't heal. And then their pain comes back. But here, I think you know, he was, again, an ideal patient. He followed all the restrictions. He was very conservative about becoming too active too soon. And now he's reaping the benefits of following the restrictions. And, you know, within 2 months, he got recovery of the loss of sensation that he had had for several years and relief of the leg pain, which is great.
I have to say thank you because it made my whole life change. Because I'm not really, I don't want to be vulgar, but I don't feel like I'm mean anymore. I'll say that because I was turning mean, and I'm going back to the gym now because I'm at the gym 3 days a week now. So it's a big deal for me because I was out of the gym for a long time, and I think it's remarkable that I'm even in there. And it is because of what he did, but he was truthful to me, and that's what really made a better experience.
To get started today, visit thisspine.com.